Ladies and gentlemen, good afternoon. I'm Rob Recker, President of Chamber Benefits, Inc., and it's my pleasure to welcome you to this afternoon's webinar. My role at the Chamber is to help you save money on your most essential business expenses. And we know that when we can save our members money, they reinvest those savings back into their businesses. I want to thank you for joining us this afternoon and for being a valued member of the Chamber. This is the final webinar of our three-part series. And this afternoon, we're going to focus on how biosimilars, GLP-1s, and the regulatory landscape impact your plan and your people. Our speaker for today's webinar is Shana McKinney, Doctor of Pharmacy, Clinical Account Manager, and Senior Advisor for Cigna. Shana serves the Tennessee, Georgia, and Alabama markets in her role within Cigna's pharmacy sales and account management as a Clinical Account Manager. Joining Cigna in 2019, in her current capacity, Shana supports existing and prospective clients by providing pharmacy benefit performance management results and aligning target solutions to Cigna's overall value proposition. Dr. McKinney is a native of Knoxville, moving to Memphis in 2001 to earn her Bachelor of Science in Chemistry from the University of Memphis. She later matriculated to the University of Tennessee Health Science Center to earn her Doctor of Pharmacy. Dr. McKinney has a passion for active engagement in her professional and civic communities. Appointed by Governor Bill Lee, she currently serves on the Tennessee Board of Pharmacy, as well as the University of Tennessee System Board of Trustees. A spring 2011 graduate of the New Memphis Institute, and a 2024 graduate of Leadership Memphis Executive Program, Shana has served on the Downtown Memphis Commission's Downtown Mobility Authority since 2016, where she has held several leadership positions and is the immediate past chair of the committee. She has previously served as the co-chair of the Porter Goodwill Club for the Boys and Girls Club of Greater Memphis, is a devoted member of the Memphis Symphony Orchestra's Circle of Friends, Brooks Museum of Art board member, and board chair for the Memphis River Parks Partnership. Dr. McKinney is married to David McKinney, and they have a son, Gethers. Shana, welcome, and I'll turn the program over to you.
Thanks so much, Rob. It's great to be with you all today. I'm going to pull my presentation up as we get started, and I look forward to jumping right in. But please feel free to put any questions that you may have in the chat, and I will certainly leave time at the end to get to those. And just confirming that y'all can see my screen. Want to give me a thumbs up or anything? Okay. So thank you again, Rob and Tanya, for having me today. I love all things pharmacy, and I'm excited to be here to talk to you about Cigna's programs that we have to offer for your consideration. Today, here's our discussion for the agenda today. We'll review the 2025 pharmacy regulatory landscape. We'll look at kind of some of the drivers of pharmacy spend and focus on some key conditions, particularly gene cell therapy, GLP-1s, and biosimilars. I'll also go into the value of the pharmacy benefit, looking at pharmacy spend as a key driver of the total medical costs, and how Cigna provides a holistic approach through integrated pharmacy and medical benefits to lead to reductions in overall total cost of care. We'll go through the customer journey and why having a focus on how members experience their benefits leads to better outcomes and reduction in overall spend. We'll take a deep dive into GLP-1 agonists and how Cigna is doing to help control those costs. We'll look across the specialty continuum and talk about our holistic approach across benefits to managing the access and expense related to specialty medications. And then we'll spotlight pathway specialty, which is a medical benefit that looks across both pharmacy and medical benefits to understand the lowest site of care or intensity of care for specialty medications. So just starting us off here, why is pharmacy so important? Number one, we know that pharmacy continues to be and remain the single most utilized place in a medical benefit that a customer will utilize. Studies have shown that pharmacists are the leading community provider where most people get a lot of their medical and medication care. And so as a pharmacist myself, take a lot of pride in ensuring that people are safe and well cared for through the continuum, the full arc of their medication journey. Traditional drug spend is growing in a way that we haven't seen before. Some of it's a chicken and the egg. Sometimes we're finding new drugs to treat new conditions, but in a large way, it's also that there are new targets that we've never had before to treat really unique and rare conditions. Specialty pharmacy is a great opportunity to help manage really complex and chronic diseases. Biosimilars in particular are a great opportunity to help improve access and affordability to these specialized, unique vehicles to treat complex and specialized conditions. And then connectivity, using the pharmacy data and real-time information versus any delays in and understanding how your benefits are working can lead to greater expenses across your benefits. And so what Cigna has is really acute artificial intelligence driven data warehouses that we can tell you in any given moment kind of where trends are and help you to reduce costs before we get to, let's say, an annual visit with an overview. So helping our clients see around corners and reduce costs at the very beginning. And so just as a look at our integrated benefits and how we are helping to reduce costs and improve overall health outcomes, Cigna sees and has been able to demonstrate the value of an integrated benefit compared to carve-out pharmacy carriers. With an integrated pharmacy carrier that Cigna provides, our advantage is in our integrated solutions through Evernorth Healthcare Services. Evernorth includes access to limited specialty distribution drugs through Accredo Specialty, which is our home delivery and specialty pharmacy. We have one center that you probably likely are very aware of that is located right here in Memphis, Tennessee. And also with Evernorth, we're able to provide stronger and leverage the pharmaceutical manufacturer expertise because of our volume, as well as manufacturer assistance, provide greater formulary flexibility. We have a low net drug cost and rebate driven formulary strategy across each of our formularies, quality clinical collaborations, identifying gaps in care that could be adverse drug reactions, omissions of care, and potentially multiple prescribers for similar conditions or medications. We provide an unbiased, flexible channel to drive towards the lowest cost for treatments. Beyond a carve-out pharmacy carrier, we provide a single card, ID number, portal, as well as phone number for members to access their full benefit, pharmacy, medical, and behavioral services. We specialize in holistic health engagement. What we know is when folks are more engaged with their healthcare, either through phone, email, text, that they have greater whole person outcomes, not only just for their disease state, their medical costs, but also their overall behavioral health is improved. That single point of contact helps to streamline benefit access for members. We've talked a little bit about integrated pharmacy drug management. And of course, we've got that one contract and one price that covers your entire benefit. And then we also have the ability to integrate stop loss into our services. And the next slide, we'll talk about our value of integration study. But as overall, what we have been able to demonstrate across the last 7 years is $193 per year reduction in total medical costs across the Cigna book of business. Cigna has a continuous annual growth rate below the average rate across a integrated benefit, and we're really proud of those results. And going a little bit deeper beyond the 193 reduction in total medical costs across this, our book of business, we also have been able to demonstrate a little over $9,200 in per year total medical cost savings when engaged with a health improvement opportunity. And right below that, what you'll see is what engagement looks like. So we have seamless, personalized, whole person support for customers, caregivers, and providers through every step of a patient's treatment journey. What we've been able to demonstrate is 37% greater health risk assessment, 14% more personalized outreaches, and 60% more sessions with mycigna.com or through our app. The real opportunity we see on the right-hand side, taking even a step further, looking at specialty conditions, we've been able to demonstrate a little over $10,000 per year savings when a member has a specialty condition. So think medications that are used to treat anti-inflammatory conditions, RA, psoriasis, Crohn's, and then taking even a step closer, cancer, being able to save over $16,000 per year. Diabetes, one of the fastest growing conditions in the marketplace, savings of $851. Obesity, over $10,000. Musculoskeletal, $10,000. And then depression, over $7,000. Cigna differentiates ourselves through total specialty drug management across both the medical and pharmacy benefits, proactive and personalized customer engagement, value-based provider contracts, and connected experiences for our customers and our clients. As we talk about our Better by Design and our approach to our clinical strategy, we focus on high impact areas to drive those savings and promote better health engagement. One of those strategies is really focusing on high cost conditions that includes clinical guidance and whole person support as it relates to specialty drug management, GLP-1 coverage, utilization management, and lifestyle modification support when clients choose our weight management options. Our biosimilar strategy, Cigna, since 2021, has had a biosimilar first strategy to address the high cost of specialty medications. This strategy is going to deliver over $1 billion in savings for our customers that we're really proud of. And then we have flexible formularies that are aligned to incentives toward better health and financial outcomes. Looking at a customer focus, Cigna leverages customer engagement to drive savings, and these are some of the ways that we do that. And we have streamlined prior authorization criteria powered by our pharmacy and medical data. Also, we publish our prior authorization criteria so both members, customers, as well as our providers can review our prior authorization criteria before prescribing a new medication. And that reduces any barriers at the point of sale when patients may be getting a new prescription to know that it will be covered and what price they will have to pay. Our formulary strategy focuses on quality and benefit. Again, we have a low net cost strategy with our formulary. We offer convenient savings and 24/7 support through Accredo, which we talked about with our specialty pharmacy, and I'll talk about a little bit further, but we also have access to specialized therapeutic resource centers. We have 15 unique centers that focus on various areas from cancer, asthma, allergy, RA, psoriasis, HIV, and many more in between, including rare conditions, that help to support patients and caregivers as they are initiating or continuing through a chronic and complex condition. Our medical drug management is strengthened by our data that I mentioned was AI-driven to provide better benefit engagement and drive greater savings. Our affordability and access through financial assistance programs and life-changing gene therapy access through our Embark Benefit Protection Program, I'll talk about a little bit further, is really market leading. We've been able, through our Embark program, to deliver savings and by way of surplus year over year to our clients that we're proud of, and we'll continue to add more drugs to ensure that more people have access to these life-changing or life-saving gene therapies. Cigna also specializes in one-on-one coaching across various specialty conditions and throughout the benefits. Through Accredo, we have nurses, social workers, providers, dietitians, and many, many different other specialty areas, including pharmacists in between, to provide that coaching. We have really strong contract relationships to help to reimburse at a clinical value-based system. Essentially, that means that we set standards for our providers who are in our networks to provide, they hit these metrics. They also are incentivized for providing greater outcomes to our clients and our members. And then financial protection through fraud, waste, and abuse. And it's also integrated through our stop loss and cost guarantees. And finally, the integrated predictive modeling and reporting to get ahead and manage trends and see around corners. This is kind of just a wheel to look at the benefit connectivity. And I won't read everything here to you, but I think what we want you to hone in on is number one, access. We have a digital first engagement strategy that uses online and digital tools to find care and engage with Cigna healthcare and service and clinical experts. We also use innovation through our connected care, Cigna Healthcare, powered by Evernorth Health Services, condition focused. We talked a little bit about our therapeutic resource centers at this delivery therapy-specific care for specialty medications, biosimilars, and cardio-diabetes medications. Think about GLP-1s in particular. And then finally, our affordability drivers from our clinical programs that support safety, adherence, and affordability across the benefit to reduce overall costs, but also maximize the health benefit. And so what does that mean? An integrated benefit across medical, pharmacy, and behavioral provides your members and you as customers a single point of contact for all your benefit needs, an expert dedicated account team, cohesive strategy to optimize your health outcomes and your savings, a clinical platform that's connected to care management professionals, comprehensive set of integrated reporting, a single ID card, phone number, website, mobile app, and live chat for your members to connect with us in whatever way is most convenient for them. And this provides holistic service experience for your employees. So jumping in to some of the pharmacy-specific information, want to just talk at a high level about GLP-1 agonists and the impact on trend that we're seeing in the marketplace. And so just to take a step back, GLP-1s are a group of medications originally initiated and released through pharma for the treatment of type 2 diabetes. They have since been identified to have additional cardiovascular benefits and significant impact on weight loss, as well as the protection of kidney function, which is why they have escalated in their use over these past few years. Probably most of you know the GLP-1s and can probably sing all the jingles in your mind. But just as a reminder, the GLP-1s that are used for the treatment of type 2 diabetes include Byetta, Victoza, there's Ozempic, Mounjaro, among others. And then the medications for GLP-1s that are used to treat specifically have an indication for weight management and additional cardiovascular benefits, including chronic sleep apnea, are Zepbound, Saxenda, and Wegovy. And so U.S. employers are considering, how best to consider coverage for GLP-1s as their utilization as well as their expense continue to rise. And what we are seeing in the market, in our marketplace, is that most of our employer groups, government and education sectors cover GLP-1s for type 2 diabetes, but a limited 20 to 30% cover them for weight loss and weight management because we just haven't seen the outcomes yet that we are seeing for their use in type 2 diabetes. But also you have to consider that there are 27 GLP-1s in pharma's pipeline today. 3 of those drugs are expected to be released in this year, and 3 drugs that are currently on the market are expected to have expanded indications. There are new entrants, new mechanisms of action that are expected that are in phase 3 trials. You see down at the last bullet point there, MASH, metabolic dysfunction associated steatohepatitis. Effectively, that means fatty liver disease, chronic due to chronic alcoholism for one, or it could be idiopathic or genetic, diabetic retinopathy, Alzheimer's disease, as well as polycystic ovarian syndrome. These are some of the new potential indications that will be released this year. And so whether or not to cover how best to manage these drugs is critically important to our members. And so we're helping to try to answer those questions with our programs for our clients. What you see here now is, if I were to come to talk to you last year at this time, I would have said that GLP-1s are not the gold standard for the treatment of type 2 diabetes. Instead, our treatment guidelines that align with, at that time, evidence-based treatment guidelines that require a member to have seen failure at least high-dose metformin, which has been the gold standard for the treatment of type 2 diabetes and is dirt cheap, What has changed since that time is, as of January 2025, the American Diabetes Association have updated their treatment guidelines and recommends GLP-1s for patients with type 2 diabetes as first-line therapy, and also have these common comorbid conditions of type 2 diabetes, including cardiovascular disease, chronic kidney disease, heart failure, and MASH, with the fatty liver disease that we talked about. And so Cigna has updated our guidelines to support what the leading evidence-based clinical criteria is also calling for. And so now what you would see, and if you went out there today to look at Cigna's prior authorization criteria for GLP-1, you would see for Ozempic, for example, the member would have to have a diagnosis for type 2 diabetes, as well as demonstrated lab values, but no other drugs have to be in the clinical record, because now GLP-1s are seen as first-line therapy. And what you see over there to the far right is about 80% of US adults with type 2 diabetes are eligible for GLP-1 today. And so as you are looking at your trends in your book, you'll likely start to see an increase in GLP-1 utilization. The good news is for type 2 diabetes, the data is there. They have demonstrated clinically significant reduction in hemoglobin A1C, which is the gold standard for the treatment of type 2 diabetes. And you also get the benefit of the cardiovascular, the kidney protection, as well as you may even get some weight loss in type 2 diabetics. But that's a larger question to consider as you think about also covering the GLP-1s that are indicated for weight loss. So we talked a little bit about what those drugs are. On the top, you see the medications that are GLP-1s that are indicated for type 2 diabetes. So semaglutide is Ozempic, Rybelsus, GIP-1, GLP-1, Mounjaro or teriparatide, and then all other GLP-1 agonists include Trulicity, Byetta, Bydureon, Victoza, and liraglutide. So liraglutide is the generic of Victoza that was released at the end of last year as an oral medication. And so we'll continue to watch to see if we start to see an uptick in the utilization of liraglutide over time. Down below, what you see are the GLP-1s that are indicated with optional coverage with Cigna for weight loss. For Wegovy, semaglutide, it's the same medication as Ozempic and Rybelsus. Saxenda is liraglutide. It's the injection formulation of Victoza and liraglutide, the medication that I mentioned earlier that released a generic last year. And then for GIP-1, GLP-1, Zepbound is the same medication as Mounjaro up above. The difference in the indications for weight loss and diabetes are the dosing and the duration of these medications. And so you see the benefits just at a high level. They're excellent at lowering glucose levels, weight loss, cardiovascular benefits, and provide the kidney production. But there are real challenges. They have increased prominence in clinical guidance guidelines and can be quite expensive. There have been shortages over the years. Social media promotion of these drugs has been one of the key drivers to their increased utilization. And then clients without utilization management elections are exposed to higher utilization and as a result, higher costs for these medications. So I wanted to jump into the specialty continuum and talk a little bit about what Cigna offers and why managing specialty medications across multiple lines of your benefit is critically important. And the first thing is what we all know, specialty drugs are very expensive. On average, specialty drugs cost about $5,000 to $6,000 per claim as compared to a non-specialty traditional drug, which typically costs about $60 to $150 per claim. Specialty costs are continuing to rise. Each year, plans spend about 75 times more on a specialty covered drug. A statistic that I like to throw out to my clients, and as I talk to the broker community, is 4% of utilizers are on specialty medications, yet they're driving 66% of overall trends. And so it's critically important that you manage those limited number of specialty utilizers as tightly as you can. Of course, ensuring that there is access for these drugs, but also making sure that's at the right time, the right duration. Competition for generics and biosimilars has emerged, and that's great news for members as well as our clients. And our formulary management strategy seeks to harness their potential to reduce overall spend and trend in the specialty space. And integrated specialty drug management allows for lower cost options when looking across both the medical and pharmacy benefit. We're not looking at specialty drugs in silos. We can determine based upon the drug where it should lie on the benefit and where the site of that infusion or injection should happen. And so the FDA is quite busy these days as they're reviewing new pharmaceuticals. There are 67 new medications in pharma's and FDA's pipeline today. Of those, there are 31 traditional medications, which you see over there in the lighter blue, and 36 specialty medication treatments, 9 of which are gene cell therapies. There are 17 biosimilars being reviewed currently by the agency, 6 vaccines, and 25 new generic medications. And then there's some additional categories which are pretty specialized. 26 drugs classified as orphan drugs. These are highly rare, unique drugs to treat members of our population who have a rare and complex condition where it impacts 5,000 or less people per year. Because of the orphan drug status, of a drug that's released, they get longer patent exclusivity and can garner a high price tag for a longer period of time. There are 19 breakthrough therapies that are expected for expedited development and review through the agency for treatment of serious or life-threatening conditions. And then there's 16 new oncology treatments in the pipeline today. The pharmacy pipeline has got a good bit of biosimilars as it relates to novel therapies being considered as well, which is great news. In 2024, the FDA approved 18 biosimilar medications, and that's fantastic. Competition is great for level setting on the price of these really unique mechanisms of actions and these treatment options. And then there's a total of 69 biosimilars on the market today. There are key generic opportunities that emerge as a result of new biosimilars being added to the marketplace, and there's a large number of costly orphan drugs that I mentioned. Biologics and gene therapies are seeking approval in 2025. And over the next decade, we can expect greater competition in biosimilar, which may help to lower prices and improve patient access. Biosimilars are projected to save about $180 billion for the U.S. over this period of time. So great savings opportunities. What is Cigna doing as it relates to biosimilars? So I mentioned that we have had a biosimilar first strategy since 2021 with the medication called Cigna, the medication used to treat as supportive therapy, increase white cell blood cells when a patient is undergoing chemotherapy. And we're continuing with that strategy to help lower the cost and improve access for our customers through our Humira and Stelara biosimilar strategy. So you'll likely remember that Humira's biosimilars were released throughout Q3 and Q4 of 2024, and Cigna co-preferred 4 unique Humira biosimilars on all of our formularies. What has been able to do is provide customers with an estimated savings of about $3,500 per year. We have been able to deliver the Humira biosimilars at 85% lower than the wholesale acquisition cost of the originator product. And then that leads to an estimated savings for our clients between $7.50 and $10 per member per month. Similarly, with Stelara, the number 2 highest spend drug in the world, just behind Humira, as of March of this year, or excuse me, April 15th of this year, Stelara released its first biosimilars. Cigna immediately added 3 biosimilars that are interchangeable to our formularies, again, helping to drive savings for our members and our clients. With Stelara, the estimated savings for customers about $4,000 a year, and we see a reduction of 80% below the wholesale acquisition cost for the Stelara biosimilar. I'll also mention that Evernorth, our health services company, also has a partnership with Quallent Pharmaceuticals that offers Humira and Stelara biosimilars through Accredo at a $0 copay for our members. So that means that a member can get either a Humira or Stelara biosimilar without a new prescription or needing to go back to their doctor at Accredo at no cost to them, and it's significantly reduced cost for our clients. So we're really proud of that. We will continue to evolve that strategy. We co-prefer both Stelara and Humira right now to allow providers and members the opportunity to make the most informed decision about whether or not they'd like to stay on the originator product or consider a biosimilar without having too much abrasion. So that'll be our strategy through 2025 for both of these medications, and we'll continue to evaluate in 2026. Cigna Pathwell Specialty, thinking about a broad benefit consideration. It is our national injection and infusion benefit that helps to control the cost of specialty medications across both the pharmacy and the medical benefit. Essentially, what happens with Pathwell is at the time of prior authorization for a new injection or infusion, not only is the drug reviewed by our clinical case managers, but also the site of that injection or infusion is reviewed. And what we do is we either negotiate the cost of the medication, offer white bagging or clear bagging through either the facility or through Accredo, and then negotiate the cost of the infusion or injection or the place of that injection or infusion. Pathwell was piloted beginning in 2021 for a small set of clients and began to redirect members to a lower intensity site of care or a lower cost site of care. What we've been able to deliver since that time is a 15% reduction in overall total medical spend and a 95% Pathwell member an NPS score on how they felt supported throughout the process. Even when we started in 2022, the redirection was quite low, 1 in 5,000 or 0.02% were having to be redirected, and typically to the member's home or to an outpatient facility for their injection or infusion. What's also really great about this program are our comprehensive whole person health approach across that benefit, where we offer the program called Caregiver Bridge, where a member who is undergoing a Pathwell specialty treatment can elect a caregiver of their choosing, either a family member, friend, or otherwise, or themselves, to be their caregiver, who can also have access to our digital tools, the clinical support services, social worker services, as well as our Food Smart and HelloFresh programs. That provides access to healthy nutrition and dietary support when a member is going through a Pathwell specialty injection or infusion. Along that same line, we also offer access to gene cell therapy. So as I mentioned before, gene cell therapies are typically used to treat really rare diseases. There are over 7,000 rare diseases, and of these, about 6,000 are of a genetic origin. The number of patients in the U.S. In 2023 who had a considered rare or gene level disease state that would be appropriate for these conditions or these treatments were about 1,200, and there's estimated to be a little over 14,000 people in the U.S. now that would be eligible for a gene therapy. And so we look at gene therapy treatments as no longer as a lightning strike potential for our clients, but think of it as a lightning storm. And our gene cell program allows access to the most cost-effective benefits with these new and emerging therapies, with eligible providers contracting with Cigna that qualify as in-network to manage these high-cost medications, but also we provide protection from egregious markups on the cost of these gene therapies, as well as the infusion services related to them. And then for members, we provide significant support with a dedicated care management team and a high-touch case management program for members and their family. There are 54 to 74 gene therapies anticipated by 2030, which could cost a single injection or infusion for gene cell therapy could cost $3 million. That's really significant. And so what Cigna has to address the growing marketplace in gene cell therapy and the cost is what's called our Embark Benefit Protection Program. It's a network solution that helps to shield the health plan and the customer from the high cost of a single dose of a gene cell therapy. There was an upfront PMPM fee. It was $1. It's been $1 for quite a long time, and just recently has gone up to $1.25 per month. But what we are also able to do is provide a surplus return to our clients. We've been able to do that since the beginning of Embark, and we're proud of that. Again, this year we returned 19 cents PMPM to our clients who elected this Embark protection. As it relates to gene cell therapy, what you see here, there are 43 gene cell therapies currently in the marketplace, and we are expecting anywhere from 54 to 74 by 2030, over 4,000 gene cells in the pipeline, an average $20 billion average annual U.S. spend on gene cell therapies today. So they're becoming less and less rare and more common. This is what we see as the pipeline over the past few years, going back to 2019. And on the far right-hand side, what you see is where the marketplace is going and the conditions. So from retinitis to juvenile macular degeneration, hemophilia, and beyond. And so it just shows where our new Embark program savings guarantee begins in January 2025, going up from 99 cents to $1.25. But we have been able to provide settlements each year, which we give out in March. And as I mentioned, it was 19 cents per member per month this past March. And then where is Embark going? So today you'll see these are the drugs that are in our Embark program. There are 10 today, and we expect to add at least 3 to 4 more this year. Would include blood disorders, ophthalmology, rare diseases, and beyond. And so I'd be remiss if I didn't talk about our Accredo Cigna pharmacy, which Accredo is so much more than a specialty pharmacy. Truly, it is a place where members are supported throughout their care journey through a specialty medication utilization and a chronic condition. Accredo does provide specialty pharmacy services that supports patients and caregivers navigating complex and chronic conditions. We have 27 pharmacy facilities across the U.S., one in Memphis, with 99.1% access to specialty drugs, which is a really uncommon thing that most PBMs or health plans can hang their hats on. We have 15 dedicated Accredo therapeutic resource centers, which I talked about, over 600 Accredo home infusion nurses that will come into a member's home to provide them with their injection or infusion, over 500 condition-focused pharmacists, and then personalized experience with customer satisfaction with an NPS score of greater than 92% for members who are engaged with Accredo. We have over 200 trusted Accredo physicians that we work with as advisors directly with our prescribers and their practices. More about kind of the ecosystem about Accredo's therapeutic resource centers. So I mentioned over 500 specialized pharmacists. They provide expert monitoring and support to keep patients safe while they're on therapy. And those home nurses also provide extensive expertise and support for the patients and their caregivers, providing that in-person administrative coaching when they are either self-administered a medication or giving it by IV infusion. We have patient care advocates that help with charting and help with medication delivery, the TRC nurses, and emergency nurses are available 24/7 and often overnight, even to be in your home if necessary. And we've got our social workers to help identify and coordinate services to improve patient quality of life, if that's something within their benefit or even outside of their benefit, if that's needing access to a dietitian, a nutritionist, or help navigate any social determinants of health that might be a barrier into the patient's care. We also have patient access reps, copay assistance folks, and our dietitian support. I've talked about how we have access to 99.1% specialty claims. Accredo is also certified in rare disease pharmacy center of excellence through 2027, and we've been able to deliver $3 billion in copay assistance. I think I'm getting close to time, so I want to respect that. So I just wanted to talk a little bit about the model that's our integrated model that focuses on the whole person. We talked about a lot of the things on the right-hand side of the screen. We've been able to deliver significant satisfaction to our members with that 92% satisfaction through our really broad base of URAC certified nurses, pharmacists, clinicians across the spectrum to support members and patients. We provide support through addressing gaps in care. We have over 50 oncology and rare condition patients per month that receive nutrition services from a board-certified registered dietitian through Accredo. We're also able to address health inequities, so the social workers can engage with over 940 patients per quarter for transportation services, unpaid bills, food insecurity, some of those other things I talked about. And then translation services. I think it's an under touted service that we offer through Accredo and across our full benefit source. But we have over 30 languages, including Braille, that we can provide along with our assistive technologies for hearing impaired patients to support members and their caregivers so that they can get their medical information in the language of their either first choice or that is their native tongue. And then this is just a case study for Accredo, just at a high level. It's beyond just the physical health of a member. This gentleman is a 40-year-old male with metastatic non-small cell cancer. He's taking an oral oncology medication daily. He spoke to an oncology specialized trained nurse for clinical follow-up and reported that he's experiencing side effects of mouth sores, diarrhea, and is experiencing weight loss. That nurse was verified that the patient is taking the right medications for over-the-counter anti-diarrhea medication, and ensured the patient is also maintaining an adequate oral hydration intake to support the mouth sores that he's experiencing. The patient was also instructed by the nurse on how to implement a swish and swallow spit protocol that included water, baking soda, and salt to help to alleviate those mouth sores. And then the nurse also took the additional step to help enroll them in a TheraEase Cuisine, which is an online tool designed by registered dietitians who provide personalized nutrition recommendations and treatment-specific meal planning for Accredo while patient is on the therapy that comes at no cost. And that was able to keep this member on their oral oncology medication and also relieved his side effects throughout his process. So just one small story of how the robust access to clinical services has been successful and helps real people through really complex and difficult disease states at any given time. So I'm going to pause and take a sip of water and see if there's any questions that I can answer.
Okay, does any of our attendees have any questions for Shana? Well, a couple of questions have come in, Shana. Number one, is there a process for a company to request a waiver if one of the drugs? So let me back up. If somebody was on with another carrier and they had a drug for one or a handful of employees that was not on a Cigna plan, can they request a waiver to have that drug added into their Cigna plan?
So I'll say that it will depend on your funding type. Our self-insured clients have greater flexibility to do waivers and things of that nature. Fully insured, we would have to go through underwriting to consider how best to administer the benefit that you'd like. But as a whole, we do have the ability to do waivers. You typically have greater flexibility with when you're self-insured versus fully insured, but certainly we can kind of look at your experience and what you're looking to do to make those considerations even in a fully insured situation.
Very good, thank you. And next question, this is from the recent announcement from the White House of wanting to lower the cost of drugs. If that does come into play, how will that impact Accredo and the Cigna Pharmacy for their members?
Yeah, so we are, as an organization, Cigna, we are fully supportive of the lowering of the cost of medications, 100%. I think that PBMs often get as a middle person in between the manufacturer and the patient. We often get the microscope on us, maybe more than others, about how are we driving up costs of medications. But in fact, PBMs don't actually set the cost of drugs. The manufacturer does, because as I talked about with gene cell therapy and garnering those high ticket prices when you create really novel and unique treatment options, you also get to create novel and unique sticker prices for your drugs. And what PBMs do is negotiate those rates. And with Cigna being one of those top 3 PBM having Express Script as a part of our organization, we are able to use our large buying power to negotiate down the cost of our medications, also through formulary management, and negotiate greater rebates. What we anticipate, based upon how this executive order shakes out, is that Accredo will still be around, ESI will still be around, PBMs will still be around. What we hope is that members, our clients, will see the benefit of the reduction in the sticker price that pharma may set. Obviously, pharma expends, I started my career at Eli Lilly, full transparency. I did a fellowship in US drug development. Pharma spends an exceedingly high amount of dollars on the cost to get a drug to market, and it's all at risk. What I learned early on in my career at pharma was that they love a quick kill. They love to know that a drug, a molecule, a mechanism of action is not going to work. They don't have to spend any more money on that, but they can learn from that, right? And put that towards new molecules. So we hope that through this new executive order and new policy that we can support and be a part of that lowering of the cost of innovation, because it is quite high.
Great, thank you. Last question that I have. So sometimes when a patient sees their primary care physician, then they go, say, to a specialist, their GI, those two are not communicating together on the drugs that that person is prescribed or is currently taking. How does Cigna Pharmacy kind of integrate those two together?
Yeah, that's a great question. Thank you for it. So what Cigna has is a program called Rational Med. So it's essentially a program that identifies gaps in care. Because with an integrated benefit where both the medical and pharmacy are talking, we are able to see when there are new prescribers, multiple prescribers of the same condition, multiple prescribers for maybe a same medication, for example, that you guys offer there. And it sends real-time alerts to those prescribers that, hey, you're prescribing something that Dr. D down the street has already prescribed. So it also looks for risks of adverse drug reactions, right? Dr. A was prescribing something that now is going to potentially cause side effects with a new drug that Dr. D is prescribing. So it sends a real-time alert for adverse drug reactions, multiple prescribers, as well as omissions in care. That one is probably not talked about enough, but sometimes prescribers are underdosing, not providing the right dose at the right time to prescribers. We're also able to identify those at the very time of a new prescription being put in or a new diagnosis is written into the medical chart, and it sends an alert to the prescribers. We're able to actually drive savings for our members, because when folks have an adverse drug reaction, when they're on multiple medications, it puts them at greater risk for, obviously, emergency room visits, hospitalizations, but also an increase in total cost of care. So those real-time alerts with Rational Med are really a unique interaction that we have with an integrated benefit that we're really proud of.
That's a great service. I had no idea that you offered that. So thank you for that.
Yep, really great.
Do we have any other questions from our attendees? I don't think we do. Shayna, thank you for that fantastic presentation. I learned so much this afternoon. I want to thank you for your time. I want to thank my colleague Tanja Lee, for producing today's webinar. And I want to thank all of our attendees for joining us today. And thank you all again for being a member of the Chamber. And if you want more information on the Chamber's Cigna level funded health plans, go to the Chamber website. We have lots of information and FAQs there to answer your questions. So I hope you all enjoy the rest of your day. Thanks so much, and we'll see you again soon.